everyone, this is Ricky Spencer and welcome to another of our episodes for Our Health Matters. Today we're very fortunate to have Sarah Chong, who's going to talk to us about intersectional feminism, also talking about disrupting violence in all spaces, understanding gender-based violence in schools and in healthcare settings. Yes, in 2025 there are still issues when it comes to women accessing health, affordable health and accessing health that is safe. Thank you, Sarah, for coming in today.
Such a pleasure, Ricky. I'm so happy to be here today.
So when we start the journey, Sarah, tell us a little bit about what got you into community development.
To answer that, we have to go back to when I was young. So all throughout high school, I was the number one person who would be like, oh, there's a 40-hour famine, let me get involved in that. Amnesty International, let me fold some letters, which then led to me doing some part-time fundraising. So I used to be that nice person who would come round to your house and knock on your door and give you the spiel about how, look, just for $1 a day, you could support this child, in Africa, and you could write to them and improve their well-being. So I really think that that's probably where it all started from there. And that was most likely the beginning of what my career is like now.
With your interest in activism, I've seen you over the years travel overseas as well for your passion. Why do you think in 2025 that people still sometimes don't understand that women's health and women's safety is still a priority that needs to be addressed?
I would say, and this is reflecting in my own opinion and experience, is that there's still this idea that women's health doesn't matter, that they like to sort of pass it off as women being emotional or women just having this gender war, which is absolutely not true. And I guess, it turns into the idea of what, global health equity and access means, which is every individual, regardless of their gender, regardless of how they identify in their sexuality, should be able to afford not only affordable healthcare, but have the same access and equity as anybody else.
As an intersectional feminist, so we'll
Yes.
get you to explain that. What is your position on women who are gender diverse or trans women? Do you accept and embrace trans women within the space of womanhood?
Absolutely. I mean, if someone identifies as a woman, how am I as an individual to deny that when that's someone's right? And I think for me, this makes me very cross when sometimes I see online, there are people who will start bashing transgendered individuals. And it's like, well, why? What have they ever done to you? And I think what made me really sad is there was a local council who introduced story time, and they were going to have drag queens and transgendered people come across there. And there was a mass protest, and people were like, oh, if I let these individuals come from my story time, my kids are going to turn out to be gay, or they're going to turn out to be lesbians, or they're going to question their sexual identity. And I was like, look, honestly, in my opinion, I feel like that is just the most bogus and ridiculous thing I've heard. I certainly fit in the space there where I have a lot of people in my network who are transgender or identify as lesbian or homosexual or maybe in between, or they just don't know. I kind of feel like, well, at the end of the day, my philosophy is very much well, if you cut me, I bleed. If they get cut, they bleed the same way. At the end of the day, we're all human. So why is there such a backlash? And I guess, to be very controversial, I always think those people who are the ones giving that really significant backlash, maybe they had their own, kind of issues with their own sexual identity, and then they're taking it out on other people.
I was lucky enough to be invited to one of your presentations with the CALD community, and I noticed that you do a lot of work with women's spaces and places. What do you find are some of the challenges when you're working in CALD communities?
I think the notions of how culture plays out in regards to gender-based violence, I feel like that is the biggest challenge. And not just for the women who have experienced or are at risk of experiencing gender-based violence, but also how services see them as well, and how prevention programs are actually developed. for cult communities, and the idea that, you know, there has to be a separation between the man, you know, and the woman, and not realizing that they have their own gender identities, and maybe, like, you know, what we're seeing in the Western context is that, oh, that's a genderfied role, you know, and that, like, you know, they sort of had this idea that, okay, well, you know, maybe with the man that they feel that, oh, well, that's toxic masculinity, or with the women they feel as though they're very disempowered. Actually, it couldn't be further from the truth. You know, you have a lot of men from like cold background who are like, I don't understand when you talked about me about masculinity, because firstly, there's actually really no such word, like, you know, in some languages about masculinity. Secondly, you know, they're like, well, please explain to me what this means. You know, so are you suggesting that I'm violent just because I'm coming from, like, you know, another culture overseas? So I think that's the greatest, like, you know, challenge, and one of the biggest issues that I'm trying to really look at, and I guess like rectify to some degree there through, you know, that intersectional lens.
I guess an unbiased here, my conscious bias, is what I love about you, Sarah, and your work is that when you invited me to one of your community forums, being a trans woman, you really wanted to disrupt some of the thinking around what is a woman and having trans people there. Why is it important for you to be disrupting the hegemony of heteronormativity in your work? And then we can then, is that part of your vision as an intersectional feminist?
There is so much importance that we need to place on disrupting that hegemony, because if we don't disrupt it, then who are we to make change? You know, how can I sit here and say, yes, I'm an intersectional feminist, that I practice in the area of intersectionality, you know, and I consider myself someone who is, like, you know, very knowledgeable in culture. And it's like, is that not culture in itself? You know, and going back to what I said earlier, it's like, well, everybody has a right to identify as, you know, who they decide. You know, who am I to decide or dictate, you know, and if I can bring that to the space that I'm practicing in there, then the better, because then we'll see that hopefully, you know, and I'm very optimistic that, you know, in 10 to 15 years there, then we will see a shift in, like, community attitudes. We will see a shift in policy. You know, we'll see a shift in legislation, and globally we'll see a shift in how people of transgender, or, like, you know, when they identify as, like, you know, attracted to the same sex or maybe both, you know, that there's no kind of stigma attached to it, that people are just going to go, oh, okay, yeah, sure, you are Ricky. That's it. It's not Ricky. Yes, you are this, 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 and this, and this. So I really want to get away from those labels, because it's those labels that really, I think, limit people's participation there and keep furthering, like, you know, people from actually accessing services there. And then, of course, like, going back to the idea of equity.
With intersectional feminism, what sort of areas do you kind of focus on in your belief system?
We need to acknowledge people's experiences. I think that's such a big thing. So the experience of a trans woman, the experience of a migrant woman, the experience of refugee women, the experience of African women, and so forth there. Like, every individual person has their own lived experience there. And the way that systems intersect with us there are very different. You know, I am the child of migrants, so I sit in a really different space. I am privileged, but also I am considered, like, you know, someone who could really be impacted significantly by, like, you know, the system itself there, with the stereotype of, like, oh, well, if you're the child of migrants, then you probably have a lot of trauma, and yeah, maybe, you know, or your parents don't speak English, you know, or, you know, you take those typical career routes of, finance, you know, accounting, dentistry, medicine. So, you know, you look all those things there, and then how we are represented in the system. So if I reflect on my own experience, being the child of migrants and being of Asian background, I still get the, what is your real name? You know, where do you come from? You know, where do you live? And so forth there. And it's so tiring, but it's like the system that has programmed people to think that way. You know, and I can only imagine, like, you know, how it must be, you know, for other women, you know, especially, like, you know, Black women, you know, who have faced systemic, you know, racism throughout their whole entire lives, you know, and then when cis women, like, you know, come up and say, oh, but yes, I'm intersectional because I live in the country, you know, you feel like, you really don't understand.
I know you're a big advocate for disrupting of health inequity. And I know recently we just chatted before about your experience of health. Would you like to share that with our viewers and how you felt as, and I also wanted to know whether you feel as though there is still an element of racism too that you find when it comes to healthcare.
Absolutely. I'd say that there are definitely still elements of racism. And I must point out that it is not racism as we know it. So of course, like, being like medical professionals, no one is going to tell me you're a ching chong. Absolutely not there, because that would be very obvious. But it's the way, like, do you understand what I'm talking about? Or you don't really know what you're explaining to me, because like you couldn't possibly understand the medical terminology or what is actually going on with you. So if I reflect back on my own individual experience, earlier this year there, I was incredibly sick. And like a lot of women, I kept brushing it off. I was like, if I just sleep, I'll be okay. Let me just power through, because like, I had a lot of work going on there. And that was my biggest mistake. I just thought, I'm feeling a little bit nauseous. I did do a self-diagnosis and found out that I had a urinary tract infection. But I was kidding myself, because I was like, but it's not so serious. I'll be okay. And then when I was feeling nauseous, like, I went to see, like, just not someone that I usually see all the time there, but just a doctor that was quite close by. And that doctor happened to be male. Now, in saying that there, I don't want, like, viewers to think that, okay, well, I'm being biased because the doctor was male and that's why. I'm being, I'd say not biased, but just really trying to point out the fact that this doctor, as soon as I walked in, he was already ready not to listen. I was given the brush off. I was given the like, well, if you already have a self-diagnosed UTI there, well, how do you know that that's what it is there? So there was that questionable, but it's like, okay, well, if you're questioning me about whether I actually have one, then why are you not offering me to have a test? And I presented the antibiotics that I was given. And I said, well, it's been 3 days, I don't feel quite well. Just keep taking the antibiotics there. Drink lots of water. Here is some anti-nausea medication there, because you said that you feel very nauseous. And just, he was in such a hurry to get me out of the consultation room. So, I was like, okay, well, here's the doctor. I'm not going to question that there, because I'm not a medical professional. So I took the anti-nausea tablets there, and it was the worst experience of my life. I ended up having a seizure, and it was terrible. And, a couple of days later, I found myself having to go to ED. And I was diagnosed with sepsis, UTI, and an E. coli bacterial infection. And all this could have been prevented.
Sarah, I'm just blown away with the fact that you had put your trust in the medical profession, and here is someone dismissing you, your body, not even willing to spend an extra bit of time with you to do further assessment. How did you feel when you ended up in the ED? Did your trust in the health system, has that been kind of changed as a result of this?
It really has, and now it's that trauma that comes with having been an ED and being very sick and being admitted to ICU and spending like a month and a half, on the ward, and then a month and a half recovering. Automatically your trust in the medical profession there is very you feel like, should I listen to what they say? And, like myself, and I can't help but think I'm lucky, and people are like, how can you think that way? Are you crazy? And it's like, I'm lucky because I'm articulate enough, to explain what is going on with me and ask questions and advocate for myself there, which is what I did. And I must admit that when I was in hospital, I did get excellent care, and I have excellent follow-up care, but that might not be the same for a lot of other women, and I can't help but think of women who, don't understand the system, cannot afford to go to hospital because they don't have private health insurance, do not speak the language, or maybe do not have the adequate education to be literate enough to explain what is going on.
In your work, Sarah, you've worked a lot in different aspects of, helping women, empower women to understand the science and that. What are some of the challenges when you're working in inequal communities with women to help address that?
I think there's still a lot of stigma, and a lot of mistrust of GPs, and understandably, because like back home, you would never know. And like back home, we hear from these women when we're doing the pain inquiries that a lot of them had forced sterilization at times, or that there was no adequate pre or post birth care. So there's still a lot of stigma, and especially having come here, back home they had a village support system, and here they don't have anybody. So they rely on just people that they might meet that are from the same community, but those people that they meet there are obviously not health or medical professionals. So the information that they give there is probably wrong. So these women end up really not knowing, what is true and what is false.
And what is forced sterilisation for some of our viewers who may not be sure?
So forced sterilisation is ensuring that the women don't reproduce. So it could be that that they give them contraceptives, so Implanon or IUD, or they say maybe after they have the baby, oh well, there was complications, so they'll tie their tubes, and the women would not really have any knowledge about it, or they would just think that, oh well, this is just part of normal procedure because everybody in my community had this done.
What happens when you're running your group, Sarah? Do you find that sometimes there is the disclosure for themselves, sharing their stories, that they start to get a bit of PTSD or realise? How do you process that with the groups that you run?
We always start off by giving them that safe space, and ensuring that our programs are not just sort of, here's some information, now go away. It is being able to hold them in that space and say, let's acknowledge, what you've been through. Let's validate your concerns, and let's look at how we can move forward, whether that's a referral to a counselling service, or whether it's come back, for the next session there, or whether it's encouraging them, during the session to talk, and maybe for them that is a therapeutic way, of managing their PTSD, because they feel like I'm in a safe space, I'm around people who understand what I have gone through and what I am still going through, and it's in language, so there's no interpreters. And maybe for them it's very cathartic. They feel that this is such a safe space for me. I feel like I am for once, just safe here, and I can relax enough to just talk and be open about my experiences, and just think, actually the next person that's sitting beside me has pretty much either the exact same experience or very, very similar.
I know, Sarah, I've read some stuff where you're very also passionate about the work of interpreters in Australia. Why is it important to have our interpreters more, trained, in service with the workshops that you've run before?
There is such importance because it's not just the interpretation of language. It's the nuances that come with it there. And that is why I always hold, bicultural and bilingual workers in such high regard, because not only are they relaying what the person has said there, but they're also reliving the trauma with that person as well there. And there's not enough support for these people. I mean, when I have my sessions and when my workers deliver information there, I myself there, I pride myself on being a very ethical leader, and I would always ask them, how did it go? And how do you feel? If I know that it's been a pretty heavy topic, I always ask them, how did you go? How are you feeling? Do you feel like you want to chat? Or if I'm not available, where can you go for support? It's something that can be so simple, but a lot of people just don't know about it or just don't think that it's important.
Do you think that there needs to be more work with male identifying interpreters to understand health, and also to be able to work to understand what it's like for if they have to interpret for a female
Yeah.
that's in the room.
Absolutely. I mean, it's like understanding women's health there and understanding like the reasons why they feel that way there, and being able to hold their own unconscious bias, you know, because I think for a lot of men coming from like, you know, multicultural backgrounds, there can be that unconscious bias because it's like, oh, well, my mum went through all this then. She didn't say anything there. So, you know, I mean, they may be thinking, well, why is this woman like, you know, talking so much about this there? And why is she so emotional about it? And I think, you know, not only do we need to look at like, you know, training like the interpreters there in unconscious bias there, but getting them up to speed in health literacy, you know, what is vicarious trauma? What is PTSD? You know, having that greater understanding, you know, I believe would influence better interpretations, you know, because it's not just word for word, like, okay, they say this in their language, I translate it back to English. It doesn't work like that.
And Sarah, I'm excited that you've started up your own organisation. Tell us a bit about it, the name and what its ethos is.
Through the work that I've been doing, you know, a lot of people have come up to me and they said, you know what, you know, you do all this work in the community there. Have you ever thought about starting your own organization? I was like, yeah, actually, that's not a bad idea. So the organization that I started is called Fem Solidarity, Women's Empowerment there. And our ethos is that no one is left behind. You know, that it doesn't matter, like, you know, whether you are trans or whether you identify as LGBTQI, it doesn't matter. You know, everybody, like, you know, is welcome. And really, like, you know, we want to amplify, you know, those voices that are not normally heard. Because again, when we have consultations, and I was recently just at a conference there, I looked around and it's like, we're looking at the people in the room there, but is everybody here that should be here? What about the quieter voices? You know, what about when we talk about representation? You know, where is there adequate representation? Where are the representation with women with disabilities? Where is the representation of, like, you know, trans women? You know, what about women from rural and regional backgrounds? You know, and, you know, those from new and emerging communities there. So I often see that there's a big chunk missing, and really with Fem Solidarity, we want to amplify those voices, you know, and have a formal advocacy network where we can say, okay, you know, on these particular issues there, you know, this is what these women are thinking.
So for people who are listening who want to get involved, are you looking for members, people to come in the community to put their hand up?
Absolutely. And that's another thing that I really want Fem Solidarity to be about there, is that, like, you know, we want to encourage women from all walks of life, from all ages, to come and participate. Like, whatever skills that you've got, you know, or even if you think that you don't have any, I am absolutely sure that they do. You know, so definitely, like, reach out. You know, I'd always love to, like, you know, have more volunteers, and it can be something as simple as like helping us do communications, you know, on our website or on our social media, helping us promote events there, or helping us access grants, you know, and really tackling these like topics that are so, I guess, like, you know, pertinent to women in Australia right now.
The other thing I want to ask you is, I remember you did some travels to Africa, and this shows me your passion for community development. Tell us about your journey to Africa.
My journey to Africa really began in 2010. So I think, like many new graduates, I found it really incredibly difficult to really crack the non-government organization scene. Like, I was constantly being told, you don't have enough experience. But I think the funniest one is, like, you don't really have enough experience with culturally and linguistically diverse communities. Now, back then, there was really no such thing as like lived experience. But now if someone was to tell me that there, I would really laugh, because I'm like, really? So getting back to my story about how I landed in Africa, I really wanted that experience. And I was like, all throughout my studies, I had just focused on, you know, the populations here in Australia. And I was like, let's do something different. Let's get that real experience on the ground, like out of my comfort zone there. So at that time, I was doing some casual, like, teaching in community services there, and I was sitting in the office and I was like, this is not for me. You know, I need to travel and I need to have that experience. So I spun the globe. There was a globe in the office there, and it landed on Kenya. And I was like, okay, you know, you always wanted an adventure, so this is your opportunity. So I started looking at, like, you know, women, human rights and so forth there. And then 3 months later, I found myself at the airport waiting for my friend to pick me up there. And I went down into the informal settlement areas and started having conversations with all these women there. And fast forward like 15 years, these women are now my family.
Oh.
They look after me as I look after them. It's really about the shared learning and those really ad hoc informal conversations where, sometimes you never know what's going to come around the corner. You can have a mother and her child and another child come in, and all of a sudden it'd be like, what do you do when your baby has a baby? Or if we start talking about gender-based violence, recently in my last trip there, they were really shocked when I said, gender-based violence exists here in Australia. They're like, really? But Australia is such a developed country. Like, I thought it was just here because we're uncivilized. That's what they said. And I was like, absolutely not. I said, it doesn't matter what country you come from. Gender-based violence exists there. I said, but the way it manifests itself there could be very different. In Australia, we see that there has been a shift away from that physical violence, but there's still that gender-based violence that exists there in forms of narcissistic behavior, controlling, financial, emotional and psychological and so forth there. Whereas in countries like Kenya, they're only starting to see that, and it's really sad when there's so many people come out and say, it's because these young women go out to Airbnbs in the middle of the night there. They should be married by 23 and then that will get them out of trouble and then we wouldn't have gender-based violence. So there's still those attitudes.
I am so happy that we've got people like you in the community to really change that. For the people that are listening, Sarah, and before we wrap up, what advice would you give for someone who's listening who may be witnessing a close friend being someone perpetrating some violence on them or themselves? What is the key message you, as your expertise, to tell them?
I would say lean in to listen. And it's always that old saying, you can lead a horse to water, but you can't force them to drink. So the best thing that you can do is lean in to listen and ask them, what would you like me to help you with there? Or what kind of support would you like there? And give them options. Of course, we don't want it to escalate to a point where there is self-harm or harm to others, but knowing when to try and step back and let professional services in, I think that's the hardest thing. So my advice would definitely be lean in, listen, support, be non-judgmental, and just really be there. And when they need it, hold their hand to access that service, guide them, be there to support them.
And it's not okay to have anyone put their hand on you or threaten you. I mean, that's how, it doesn't matter how much love someone says, that is not love. And that's what we have to demystify and disrupt. Sarah Chong, it's been an absolute honour and pleasure speaking with you. You've taken us on a whole journey around the world on intersectional feminism. You've disrupted some of the areas that we need to, especially medical dominance. And we look forward to watching you grow and your new ventures that are coming up. Last words, Sarah.
I just want to say I'm so glad that we met all those years back. And who knew that this would be where we are now. And it's such a great privilege to be able to come on this show and share this space with you.
And it's Ricky Spencer for Quest by Community, Our Health Matters. Thank you for listening.